Your siblings have not returned to Nepal once they went over there.
Yes.
So
Yes,
how can I believe you that you will come back to Nepal?
Yes, officer. I understand that my brother has chosen to build his career path in the United States, but my goals are different. I'm going there specifically to receive this training because I believe it will provide me the knowledge and experience to become a well-rounded physician. And on return to Nepal, I plan to apply those skills in my clinical practice. My professional goals are focused on improving the patient care here and contributing to medical education, and I believe that training will help me in achieving my purpose.
Okay, you said that you passed your MBBS degree in 2023, right? It's
Yes,
been
sir.
some 3 years.
Yes, sir.
What are you involved in for such 3 years period of time?
Officer, after completing my medical education, I fulfilled my 2-year government service bond.
What is government service bond?
Officer, that was a requirement that for the students who were enrolled in medical education in Nepal under government scholarship. I received government scholarship to study MBBS in Nepal. So following that, I was required to serve in a government hospital and as per the contract that I had signed before the joining the.
Where do you serve?
I was posted in Jiri Hospital in Dolakha. It lies in the northern central region of Nepal.
Okay. Can you tell me some 5 activities a physician must do?
Officer, physicians should maintain a strict ethics during their clinical practice. Internal medicine physicians, to be exact, they evaluate patient, they form a diagnosis, and they manage the patients across wide range of medical conditions. They take into account, they follow up the patient to monitor their progress and change the treatment plan if necessary. And above all, internal medicine physicians have a very holistic approach to patient care.
Need to working out it also, right? The आफैले गर्ने चिजमा अलिकति असमक भइरहेछ हैन. As a physician, हैन, I have done this and I require to do this, right? You can clearly आउनु पर्यो. All right. So what is the career objective? What do you want to specialize in, and how does this program help you build your career?
Officer, this program will help me train in internal medicine subspecialty. It will provide me the knowledge and skills that I require to become a competent internist. I'm particularly drawn to caring for patients with chronic diseases like diabetes and hypertension. So I believe this training will provide me the skills that I need to improve the management of these conditions in Nepal. And it also will provide me an opportunity to contribute to medical education by mentoring the medical students while promoting evidence-based practice.
Okay, how do you expect to get the return of your investment for your MBBS degree and for this training? As it I believe is the investment of huge amount of money as well as time. So how do you expect to get the return when you plan to come back to Nepal?
Yes, officer, I understand the financial considerations that has gone into my medical education, but what I value more is the quality of training, the emphasis that this training is providing on evidence-based practice that I have always wanted to train into. And I believe that this experience and knowledge will equip me with the proper values to become a competent internist. What I value more is that training, the quality of this training that will help me become a better physician, help me practice and earn the prestige that I have always desired in this field.
So where will you stay?
Officer, I will stay at an accommodation near to hospital.
Near to your
Hospital.
Hospital.
Yes, sir.
Do you know about the locality over there, the demography over there, and difficulties, let's say challenge or some challenges you will be facing over there? Are you aware of it?
Yes, officer. My university is located in the city Mobile. It is the third biggest city of the state. Regarding the patient demography, about most of the population there, about 50% are African Americans, and about 40% are the white populations. And based on the demography, I expect to see medical conditions mostly related to non-communicable diseases there, especially the ones related to lifestyle related factors. And I also know about the various adversities that may arise in that locality, in that city, because it is located in the Gulf Coast. And regarding the weather patterns, I understand that it is more susceptible to tornadoes and hurricanes. But above all, I've selected the reason for the career opportunity that I will be having for the broad clinical exposure that the program provides.
So you want to specialize in non-communicable diseases, as you tell.
Yes, sir.
Can you name a few of those non-communicable diseases that you want to specialize in?
Officer, I'm mostly interested in caring for patients related to diabetes, cardiovascular related diseases like hypertension, coronary artery disease, lung conditions of lung like chronic obstructive pulmonary disease, and other lifestyle related diseases such as relating to different body systems, such as we have fatty liver related to.
Okay, well, as a medical officer,
yes,
what do you think is more important, a lifestyle or medicine?
Officer, as a medical officer, I believe that there should be first, as a person, we should focus on preventive aspects of medicine. We should do everything in our capacity to avoid any healthcare crisis. It is better to adapt to a healthy lifestyle and to understand the various implications that a particular disease can have. But simultaneously, if we do suffer from disease, because there are some other aspects like genetics as well that can affect the patient's susceptibility to disease, in that case it is better to adhere to the medical guidelines and to the advices from a doctor.
You said that you will come back to Nepal, right?
Yes, sir.
So is there any organization, any job in your mind that you will do immediately as you come back to Nepal?
Yes, officer. After completing the training, I plan to return to Nepal and join a faculty at a teaching hospital where I will continue my clinical practice and also involve in medical education, mentoring the medical students and junior doctors.
How much do you expect to earn doing this job?
Officer, based on the current estimate, I expect to earn around 150 to 200,000 Nepalese rupees per month initially. As I gain experience, I also plan to establish my own private practice that will supplement my hospital work while also contribute to my career.
Why don't you plan to stay with your brother, as you said that he is in the same place where you are going?
Officer, my long-term plans are to build a career in Nepal. I'm particularly drawn to working in the field of managing chronic diseases in this community. I feel strongly connected to serving the community in Nepal because I have a clinical experience of working with the people of Nepal, and I've understood their problems, and I also understand what the possible solutions are. I just need this training so that I can act better on the solutions, think about the ways in which I can provide accessible and affordable care to those people.
What if I don't grant you visa today?
Officer, I believe that I have presented my application clearly and honestly, and I hope for a positive outcome. But if I don't get approved today, I will respect your decision. I'll work on areas where I can improve, and I will continue working on my professional goals.
I see that this is your second attempt.
Yes, officer.
Why second time?
Yes, officer. My previous J1 visa application was refused on June 3rd, 2000 this year. And officer, after my previous visa application, I felt that I wasn't able to explain my background and intentions as clearly as I wanted to. So I worked on improving my communication skill. I also took professional communication training because I felt that it was valuable for clinical practice as well. And officer, matching into this training is a big professional opportunity for which I have worked so hard. And I also informed my residency program, and they were supportive and encouraged me to reapply. So I reapplied as soon as possible because I did not want to delay much of my training time.
But I see that you have already missed some of the time for your training, right?
Yes, officer.
So how will you adjust on it?
Yes, officer, I understand that my original date has passed because I wasn't able to get another visa interview date earlier. I informed my residency program and J1 visa sponsor about the situation, and they were supportive. They encouraged me to reapply, and my residency program has confirmed that I can join the training at a later date. by fulfilling all the onboarding requirements. I also have a support letter from the program which I can provide it to you.
All right, thank you so much.